first let's get the toys out so that we can have a better idea about this. So what you'll see is any loop of intestine that has this longitudinal muscles on its surface. This is only present in the large intestine, and these are called the Taenia coli. If you go on the right side, you will see that Taenia coli are muscles that are only present in the large intestine, and if you follow them down, they all fuse together in the appendix.
Are they smooth muscle?
On the right side, absolutely all muscle is smooth, my dear. There's no muscle that's skeletal in your intestines, except in upper 1/3 of the esophagus, or in the area of the mouth, But they too are in the esophagus, it's not under your voluntary control. Very good question. So this is the longitudinal muscle that's only found where? In the large intestine. Whether it's transverse colon, whether it's descending colon, or whether it's sigmoid colon. So you will see it follows all the way through in the large intestine. It's like, have you seen a high school band? And you see those, these guys and girls, they wear those trousers, which has a band that goes on the side. So the large intestines wear a trouser like that. Okay? And these are called Taenia coli. Once they were witnessed for the first time, people thought they were those intestinal worms that are called Taenia, which are the long ones. So they are named after them. But appendix is invariably found where? Attached to the cecum, which is the blind loop of the intestines. And if you follow these Taenia coli, they fuse together in the appendix. Appendix can be found in different sacs. It's like a slippery fish. So if you start searching for it blindly, it may take you about 5 to 10 hours. And by that time, the anesthesiologist may have decided to murder you or kill you. Okay? Because, I'm sorry to use such words, but they cannot stand the patient being under anesthesia for such a long time. They could have cardiac arrest. So, therefore, very, very important. Second question is, what is the narrowest part of the human GI system? The answer is the junction between the ileum and the large intestine, and this is called the ileocecal junction. Where the small intestine ends and the large intestine begins is the narrowest part of the human gastrointestinal system. And this is called the ileocecal valve. If a child eats a foreign body, how would you decide whether you have to send in a sigmoidoscope or an endoscope, or whether you have to do surgery? You wait for that foreign body, you evaluate its size, and if it has passed through the ileocecal junction, then it's very likely that it will safely pass through the intestines. Other than if it's a sharp object like a blade or like a scalpel blade, that's very dangerous. That has to be, you have to do some invasive procedure.
So one more time,
Okay?
it's a junction between the ileum and the...
And the cecum. Cecum is the first part of the large intestine, which is like a blind loop. This is cecum. And the appendix is attached to the cecum. So this blind loop, which is like a pouch, which is like a pocket, is the cecum. This is the ascending colon, which goes up. This is the transverse colon that goes transversely. This is the descending colon that descends down. And this is the sigmoid colon that curves like the letter S. And then you have the rectum. And in the end, you have the anal canal. Okay? So these are the parts of the large intestine. So if you are asked, appendix is attached to which part of the large intestine, the answer is the cecum. What is the narrowest part of the human gastrointestinal system?
The ileocecal
The ileocecal junction. If you are asked, what is the only location in the entire human GI system from where vitamin B12 is absorbed and bile salts are absorbed, the answer is the last 2 inches of the ileum. So if these last 2 inches of the ileum are resected, or they are affected with Crohn's disease, or they develop a diverticulum, or they develop some other disease process, that person has to be on injectable or some other supplements of vitamin B12 and bile salts to live a normal, healthy life. So what is the only location in the human GI system from where vitamin B12 can be absorbed? Last 2 inches of the ileum. What is the location from where bile salts can be absorbed? Last 2 inches of the ileum. Do you understand how much is an inch? You have a little bit of an idea? 2.5 centimeters approximately is an inch. Okay?
See where it is again?
Sorry?
Can I see where it is?
It's right here, my dear. This is the ileum.
Okay.
So these last 2 inches of ileum is the only location, my dear,
So
from
these-
where
that's
vitamin
5
B12 and the bile salts can be absorbed. Now you understand why? What is the importance of bile salts?
They emulsify.
Excellent. And as soon as they break down, then what does the ileum do? It reabsorbs them back. So this is called the enterohepatic circulation. They go into the intestines, they are reabsorbed, go to the liver, then come back to the. It's like two kiddie brothers who play on bunk beds. One goes down, the other goes up, then the other goes up, and then they have those stairs and they are so happy. Till somebody has a head injury or they fall, and the mom then goes and whacks both of them. Okay? So the thing is, this is what happens. That's why we are in very less requirement of bile salts. But if this is resected, you have to give the bile salts parenterally, through some other way. Is that all right, ladies and gentlemen? So now can you differentiate between the large and the small intestine by appearance? Or will you pull the entire 15 feet out? And then you'll say, no, I have to put it back together now, but you cannot. And then you'll ask the chief surgeon, and he'll use those words that are $10 words in front of everybody for you. He is going to talk like Bridget Jones, you know, she talks. Have you seen Bridget Jones movies? So, you know, they use some words that start with the letter, I'm sorry, F. Okay, I'm sorry, my apologies.
Potty
for that.
mouth.
Yeah, so basically, that's what they will tell you.
Kim's never heard that.
Yeah, please, so it's very, very important, ladies and gentlemen, for you to know the difference. Now, you understand the difference between the mesocolon, the mesentery, and the omentum?
Not yet.
Okay, very good.
Get on, bring it.
Very good, ladies and gentlemen. Now, what you need to know is, there is a membrane in your abdomen that is called peritoneum. Peritoneum is the serous membrane that attempts to enclose all abdominal organs. It's attached to the posterior abdominal wall. The entire large intestine is covered by the peritoneum, and there is a sleeve of the peritoneum that attaches the large intestine and makes it almost fixed with the posterior abdominal wall. And this is called the mesocolon. And the mesocolon is connected to the serosa, the outermost layer of the large intestine. So what layer attaches the large intestine to the posterior abdominal wall? The mesocolon. And what is mesocolon a part of? It is a part of the peritoneum. So mesocolon. And then, ladies and gentlemen, our small intestines are attached via a similar membrane to the posterior abdominal wall, and this membrane is called the mesentery. Mesentery is also the part of the peritoneum, but mesentery attaches the small intestine to the posterior abdominal wall, and it's a layer of the peritoneum. Very, very important to remember that duodenum, the first part of the small intestine, does not have any mesentery because it escapes behind the peritoneum. It knows the peritoneum is a control freak, and after the first date, it says, I'm sorry, I am psycho. And I see a psychiatrist and I take 6 medications for mood stabilization. I'm not good for you. Because it knows the peritoneum is a control freak. And it wants to get out of the clutches of the peritoneum. For that reason, only jejunum and ileum bear mesentery. Duodenum does not bear a mesentery. Is that all right, ladies and gentlemen? In addition to that, you need to know that the stomach, if you look at the stomach, it has an outer curvature which is called the greater curvature. From the greater curvature hangs a layer of the peritoneum that's called the greater omentum. So, ladies and gentlemen, What is the greater omentum? Greater omentum is a layer, double layer of peritoneum that hangs down from the greater curvature of the stomach like an apron. When you open up somebody's abdomen, the first thing that you see after the muscles is what? The greater omentum. It hangs down. For that reason, the greater omentum is called the policeman of the abdomen. When somebody has an organ that gets inflamed, the greater omentum goes and surrounds that organ. So greater omentum is hanging down from what part of the stomach? The greater curvature. Let's look at some pictures here, ladies and gentlemen. So this is the greater omentum. If you see in this picture, you see here how it's hanging down from the greater curvature of the stomach. When surgeons open the abdomen, usually they are very mad with people who are, with due respect, fat. Because their greater omentum bears lot of fatty tissue. And then they say that I have to clear up their mess. They ate cheeseburgers all their life, now I have to clear this, you know. And thank goodness the person is under anesthesia. They cannot hear the surgeon saying those, singing their praise. Okay? So greater omentum hangs from where? The greater curvature of the stomach. In the same way, from the lesser curvature of the stomach is attached the lesser omentum that connects the stomach to the liver. So let's look at a picture of the lesser omentum.